In terms of medication, I think people are often anxious about medication, and that's one good reason to come and see a psychiatrist, because you want to have a full assessment and you want to be sure that you're starting on the best medication at the lowest dose with the least side effects. And that's something we take very seriously, obviously, in this clinic. I don't think you need to be too nervous about medication. We wouldn't start it unless you're in agreement and if we felt together that it was the right thing to do. We start medication slowly at a low dose, and as I said, we monitor closely for any side effects. You know, if you were to experience side effects, I mean, common things with common medications like antidepressants are, you know, a bit of gastrointestinal disturbance, maybe the odd headache. There are some more severe side effects, but they're very rare, and generally we don't see them. And if, you know, this is one of the reasons we do blood tests, because that's a way of monitoring if there are any problems. I have to say, in my practice at the Sloane Court Clinic, I have rarely, if ever, seen severe side effects with the antidepressants. I think another concern people have is about stopping medication. For a first episode of depression, generally we advise staying on medication for at least 6 months after you feel better. If someone's had a longer mental health history, it may be necessary to stay on medication for longer. But again, that's a decision, a risk-benefit analysis that we'd make together. Although this is a recognised issue, generally speaking, we find that if we, you know, follow the guidelines carefully, and when someone feels better, it is possible quite safely to carefully reduce medication to stop. And again, we rarely see problems when people can't get off medication or have significant discontinuation syndromes when they aim to do so. So I think obviously if you experience problems with your medication, you'd discuss that with us, and we'd think about how severe it was, and if it was troubling you, we'd find an alternative. And it's quite routine to stop one medication and try another until you find the right medication for you. But it isn't all about medication. And so, you know, medication suits some people and it doesn't suit others. Some people want to use medication alongside other interventions, but some people can find the solution they're looking for without needing to take medication at all.